Thank you, Professor Fasching. As ADC such as T-DXd move into early treatment lines, clients face increasingly complex sequencing decisions. What are your key decision-making factors when design treatment for high-risk HER2-positive or HER2-low patients?
Are you referring now to early breast cancer or?
Uh, for high-risk HER2-positive or HER2-low patients.
Okay, if you're moving to the HER2-positive patients, we've seen major advancements over the last 30 years in the metastatic setting. And there, of course, with the pertuzumab, with the trastuzumab, and the T-DM1, first generation antibody drug conjugate, subsequently PFS and overall survival were improved over time. And when we're going to the early breast cancer setting, there in the HER2-positive study, we've seen the DESTINY-Breast05 study, also including in the HER2-positive, in the very high-risk HER2-positive, we've seen an improvement of outcomes introducing T-DXd instead of T-DM1 in patients who do not respond appropriately to the neoadjuvant treatment with chemotherapy and anti-HER2 treatment, where even the axilla would still have positive lymph nodes. And in these patients, the T-DXd has shown a much higher efficacy than the T-DM1. So therefore, of course, in the HER2-positive setting, with the T-DXd, in that population of the DESTINY-Breast05 study, the T-DXd is superior to the T-DM1. In the HER2-low setting, in the early breast cancer setting, that concept has not been that far developed yet. Now we're referring in the metastatic setting to the hormone receptor-positive HER2 negatives and even a small subgroup of the triple negatives, where even tiniest expressions of HER2 might be sufficient to help us to make a therapy decision for T-DXd, an anti-HER2 topoisomerase 1 ADC, where we have seen in hormone receptor-positive HER2 negatives improvements in the metastatic setting of progression-free survival and overall survival, and even in small subcohorts in triple negatives, also substantial benefits for both of these outcome parameters. But in the early breast cancer setting, HER2-low is not developed yet, but in HER2-positives, of course, in a high-risk population that failed the neoadjuvant therapy, the T-DXd has shown superior to T-DM1 in the respective DESTINY-Breast05 trial.